Welcome back. As we just mentioned before break, there's a new procedure to help patients lose weight, all while avoiding a major recovery time, and it's being offered right here in Peoria. Dr. Jason Beal, an interventional gastroenterologist with OSF Healthcare, joins us now to explain more. Good morning, doctor.
Good morning. Thanks for having me.
Absolutely. So could you just tell us more about this procedure and what it is?
Yeah, so, we've started what's called our Endoscopic Bariatric program here at OSF, and it really encompasses two different procedures. I would say the main procedure is called the endoscopic sleeve gastroplasty. And so, so this is all, it's non-invasive, meaning it's non-surgical, just like we do normal diagnostic upper endoscopies where we put a camera into the stomach.
Okay.
The only difference is I'm putting a suturing device on the tip of that camera. And so we go down, when a patient's asleep and comfortable, we would then deploy sutures. We run 6 to 8 sutures back and forth within the stomach. And as we tighten these sutures, that physically will shrink down the stomach. We're hoping to reduce the volume of the stomach by about 70%. We're kind of mimicking what the surgeons do with their surgical gastrectomies. We're not doing any cutting. We're actually just creating that kind of sleeve appearance of the stomach with our endoscopic suturing device. The second procedure that we're offering is called a transoral outlet reduction. It's for patients who have already underwent bypass surgery, but they're 2 years out, they're struggling, they're gaining weight.
Okay.
Through this evaluation, they're found to have dilation. Their pouch that the surgeon created has just gotten bigger, and the opening from that pouch to the intestine has gotten bigger. And so there are people who we can actually suture that, to a narrower diameter, thereby giving that sensation of I feel full, and they start to lose weight.
Got you. So who would be the right candidates for a procedure like this?
Yeah, great question. So for the endoscopic sleeve gastroplasty, our perfect candidate obviously has to be motivated.
Right.
BMI, we do have a body mass index, so that's height and weight calculated to a body mass index of 30 to 50. That's our FDA approval for use of the device. Again, the patient's motivated, they fit in that criteria. And the other patient that I think it's common that they go through the surgical workup, and they kind of get to the last step and they're like, let's back up a little bit. I'm really not excited about a surgical intervention. And I think that's where the endoscopic intervention fits in quite nicely.
Nice. So doctor, what does recovery look like?
Recovery's fairly straightforward. There's risk to everything. We do these procedures under general anesthesia, but you go home the same day. What you can expect with the sleeve gastroplasty is some abdominal discomfort. That discomfort usually resolves in about 3 to 5 days. Usually it does not require pain medication. But the biggest side effect that I see is nausea. Nausea is expected after the procedure. We do treat it pretty aggressively.
Okay.
Again, that dissipates after that first 72-hour window.
Okay.
Once you get through that, in 7 days, most patients feel back to normal.
It's not bad. So with weight loss drugs like Ozempic seen all the time, how does this procedure you're offering connect with other weight loss techniques?
Yeah, I think with the obesity epidemic that we have, I think it's kind of all hands on deck. I think these drugs are wonderful. I think they've worked very well for people. But I think they probably, the question I have with the drugs is longevity, right? Do you take these medications for years and years? So is there a better long-term option? And I would argue yes. I think surgery and I think this endoscopic procedure has been shown to have good 5-year, 10-year weight loss data. So maybe we need to be using these two things in combination.
All right. And lastly, if someone was interested in this procedure, how can they learn more information?
Yeah, it's pretty easy. You can just call our office, OSF Gastroenterology, mention that you're interested in endoscopic bariatric therapy, and we'll get you in touch and get you a consultation.
Nice. Okay, I actually have one more question.
Sure.
Let's talk about lifestyle. What daily changes would someone have to make?
Yeah, that's probably the biggest piece of the puzzle, the lifestyle piece, right? We are lucky at OSF. We have a whole weight management center that sees patients pre-procedure, whether it's surgical endoscopic, pre-procedure, post-procedure. And so we're going to help you make those right choices. But yes, without that lifestyle piece, these procedures are unlikely to be successful in the long run.
Okay, and then I know I said one more last question, but this is the final one. If someone was on like Ozempic or Wegovy, could they still do this procedure?
Absolutely.
Okay.
Yeah. Again, I think those are the patients that may have the most robust weight loss, actually.
Alrighty. Well, doctor, thank you so much for joining us this morning. We'll share more information on our website at 25newsnow.com. We'll be right back.
Thanks.